next speaker, I would like to invite Dr. K.K. Kalra, CEO, NABH, for the special address.
Secretary Department of Health, Government of Maharashtra, and Dr. Dilip Gupta from eHealth, Dr. Dilip from President IMA Association Maharashtra, and Dr. Nati, Dean and Faculty of Health Environmental Sciences, St. Joseph Institute, and distinguished audience. Good morning to all. And first of all, I congratulate the Government of Maharashtra and Dr. Dilip Gupta from eHealth for organizing such a wonderful summit, and also thank them to invite us in this conference. Why we are talking about in this session transformation of hospital and healthcare? Already Mr. Nika has focused because this is a patient safety issue. Day and night in the hospitals, what is happening, how patients are being treated, already has been explained. And patient safety is a big issue. It's not only in our country, it is a global issue throughout. But when we talk about patient safety, this is not a new concept, it's not a new emerging need of the day. Even the Hippocratic oath, the doctors take, even that also talks about first do no harm. Besides this, even Florence Nightingale, everybody knows, about 140 years ago, she also said, the very first requirement in a hospital is that it should do the sick no harm. And what harms we are talking about? Patient goes to a hospital for a particular ailment and for the treatment. It should be treated for that particular disease only, and comfortably, satisfactorily it should be discharged. But what happens? During hospitalization, he is harmed in so many ways. So these are the patient safety issues. The studies in various developed countries, Canada, US and others, they have seen that 1 in every 10 patient gets hospital-acquired infection. 1 in 10 suffers from a medication error. A wrong dose is given, or to a wrong patient, or dose is missed like that. And around 1 lakh deaths occur due to medical errors or adverse events related to hospitalization. This is almost a decade-old data, and from advanced developed countries, you can imagine in India, maybe minimum 4 or 5 times more than this error are occurring. And most commonly, these medical errors they result in average increase in length of stay by 4.6 days and increased hospital cost. And cost is near huge. Patients in the public sector, the hospital, the government has to bear cost, and the public. And almost as high as 13% of these medical errors can lead to deaths. The good point is that if there are safety cultures, 31 to 51% of these medical errors are potentially preventable. Even things are changing now. 2 decades back, doctors were considered as next to God. No patient could even challenge a doctor's decision. They simply whatever doctor prescribed, and they should accept. But nowadays it is the same scenario. Most of the time, patients are now getting more and more aware. They have seen, they have done the local search. At times they know much more than even doctors. They want to argue. They want their involvement in decision making. And no more they are considered as similar to God. And another concern is the rapid change in advancement in technology, and new equipments are coming, new treatment guidelines are being set up almost in the country. Are we capable, updating ourselves to the latest No. Then in our medical colleges, in nursing schools or in paramedical schools, there are no curriculums which taught about patient safety and soft skill development. Most of the error, it has been studied a lot. The most important cause of medical error is lack of communication. All errors lead because of some kind of there is a communication gap. They lead to these errors. On one side, in India we have seen in the healthcare sector is tremendous boost. There is growth, very high growth in the private sector, and it is likely that by 2020 there will be a healthcare growth and to reach US $280 million. But still, quality remains a serious concern. Accessibility, affordability, inequity and quality of the care still remain a big challenge. The out-of-pocket expense by a common man in India is almost as high as 60 to 70%. The various reports tell that. And as per WHO checklist of ranking of out-of-pocket expense, India stands third. So, other challenges we face day in day out is poor infrastructure. We talked about quality, we talk about accreditation, but the poor infrastructure is very poor. There is a gross inadequate human trained qualified manpower, and even there are certain doctors and nurses who are registered but they are not practicing. So there is an underutilization of those qualified personnel. And there is again a preference to work only in metros or urban areas where only 1/3 population lives. But in these areas, only 2% of the qualified allopathic doctors are willing to work or they are working. There is low penetration of insurance throughout the country or other care mechanisms. The poor health regulation and standardization of care, there are hardly any protocols are being followed. And high dependence on imported equipment, especially our life-saving equipment, we depend on mainly on imported equipment. And poor use of IT technology. Simple thing, ICD-10 classification. Most of the hospital, most of the doctors and other staff, they resist. They are not willing to start ICD-10 coding. And then there is no monitoring of outcomes. There is no record. We do not have a national level any database about medical errors. And poor use of IT technology for information exchange and electronic health records. Is it any single agency can take care of these problems? No. Government is basically the public sector. They are mainly concerned with statutory formulations and regulations. And private sector is mainly in 60% of the inpatient care being taken care of in our country by the private sector. And in outpatient, 78% of the patients are being treated by the private payer. So it is the collaborations. As of date, this transformation will only be possible by an effective collaboration between public and private. And innovations. Innovations will only reduce the cost, the affordability. It only can when we are collaborating and we are doing innovations, effective innovations. Collaborations may be in various fields. Collaboration may be to increase insurance coverage. An excellent example is under Madam's leadership, the Rajiv Gandhi Jeevan Arogya Yojana, a government of Maharashtra is an excellent example of collaboration. And under this scheme, the Health Department of Maharashtra has developed implementation criteria for the participating health care facilities. These criteria have been finalized in consultation with the NABH, Quality Council of India. And initially, few of these, some essential parameters have been selected within the constraints of infrastructure and ground realities existing in the country. We cannot bring a change, or we cannot expect accreditation of hospitals in short time because existing our infrastructures and other ground realities we have to keep in mind. Gradually, over a period, we can raise the bar for quality. That's what we have been trying under this program. And to that effect, a training on these criteria or standards has been started with the help of NABH Quality Consultants India, and almost as more than 500 doctors and other staff, big staff, has been trained, and then more trainings are being scheduled in the coming time. Accreditation definitely can help to take care of these patient safety issues, as well as health can become more affordable and accessible. But it is a little time-consuming process. Keeping that in mind, what we have done recently in the NABH, we have started few more levels, so that at least where people are having good intentions, they can come forward and they are ready to accept quality concept. They are ready to build safety cultures into the hospital. We have started the pre-accreditation level, entry level standards for hospitals as well as for small healthcare organizations. And besides that, we have started few more programs like SafeEye. SafeEye deals with the hospital infection control, because in our NABH standard, the chapter 5 deals with hospital acquired infections. They are the major concerns of patient safety. And under this program, it can be effectively, very easily, the hospital can be transformed over a period of small 3 to 4 months, and hospital acquired infections can be controlled or prevented by this program. Then another new program we are starting is the nursing excellence. If we are able to improve nursing care in a hospital, automatically most of the things, the problems are taken care of. And then third program we have started now in a modified way is the how to improve medical laboratory programs. So in this way, definitely we will all work together and we will be able to bring a change, the desired change for quality culture in across the country. Quality is nothing more. It's only talk about a change of mindset, attitude and behavior. Otherwise we have all the capabilities, only we have to convince ourselves that we should adopt quality practices for this guys. Thank you.
Thank you very much, sir, for sharing your views on how accreditation can help in improving the standards of quality of healthcare and how public-private partnership can contribute a lot towards infrastructure, manpower, resource development in healthcare industries.